I'm Dr. Alvin Thomas. My work and this show is dedicated to educating, validating, elevating, and celebrating the importance of Black fatherhood. This is the Black Fatherhood Podcast. So, a couple of weeks ago, I posted on Twitter that I was looking for individuals, preferably Black males, who did therapy with Black men or who were life coaches who were willing to work with Black men and might also identify as Black men. And about 2 weeks went by and nary a response, maybe a couple of likes for the posting, but nothing beyond that. And I was asking because somebody else had reached out to me and said, "Hey, Alvin, I'm looking for this kind of service for a relative or a friend. Do you know of individuals providing those services?" And about 3 weeks went by and zero responses. I invited persons who did that work to also use that platform to publicize, to share that they did that work, and that I would be able to hopefully magnify that post. Still nothing. Access to support systems that focus specifically on Black fathers is even more scarce than access to support systems just for Black men in general. And I commented on my own Facebook post that if it was so difficult to just identify resources for Black men in general, then the idea that Black men's health and mental health is a dire concern, a dire public health concern, is actually very true, and that this was living testament to that. Efforts towards moving towards this more inclusive or father-inclusive services must embrace two levels of involvement if we want to get fathers involved in therapy, if we want to get Black men involved in therapy. And those are father awareness and father friendliness. The work of our next guest turns the spotlight on the idea that understanding and supporting those concepts requires a multidisciplinary dive into socioeconomics, both past and present, mental health, social justice, housing, social work, community support, and so much more. Our guest today is Dr. Latrice Rollins. She's an assistant professor at Morehouse School of Medicine in the Department of Community Health and Preventive Medicine and Prevention Research Center, and the director of the National African American Child and Family Research Center. Dr. Rollins is a Robert Wood Johnson Foundation Culture of Health leader whose work is focused on father engagement and father-inclusive practices in health and human services. She also worked for the State of Georgia Division of Child Support Services as a community resource specialist for the Georgia Fatherhood Program and as an enforcement agent. Dr. Rollins is the author and editor of Engaging and Working with African American Fathers, Strategies and Lessons Learned. Thank you very much and welcome, Dr. Rollins.
Thank you so much for having me. It's a pleasure to meet you finally.
It's been a while. We had this long road. We were talking about a friend of ours who actually was on this podcast last season, Dr. Kiana Cryer Coupe. Hopefully, some of you will be able to jump on there on the first season and kind of take a look at and listen to the really, really powerful conversations that we had with her. And I expect that that's what's going to happen today as well. So let's start with who is available to offer this support for Black fathers and why.
Depends on what we're talking about. So there are a number of fathering organizations and a number of people who do serve fathers, but they don't know about each other, and a lot of times the fathers don't
Mhm.
know about them. And so what I have really loved doing here in the Metro Atlanta area is bringing all of these organizations together so that they can know each other and they can leverage each other's resources. Because what we find is that there are more people doing a lot of good work than what we know about. And so it's like, oh, okay, we just need to get the word out. It's not that we need to create new programs or create new services. We just need to get the word out about what's already going on. So there are a number of resources in mental health, in physical health, in parent education, justice, family law. There are a number of resources there. It's just about getting the information out to the dads and to other organizations who can refer them to those services.
I really agree with you. That story that I was telling about trying to find services, what ended up being, or the end of that story was that somebody eventually forwarded to me, a friend of mine eventually forwarded to me this network that specifically works with black men in therapy. And on that network, it was just really great and encouraging to see so many therapists as well as life coaches whose primary goal was to work with black men and with
Hmm.
black fathers. And so I was able to provide that to the individual. And hopefully, I think we should be able to put that as a link somewhere in our podcast so people can find that resource when they need it. So if I were to say this thing, which I think we're quoting from you, if I were to say this, I would potentially get a lot of flack for it. And that is that the majority of helping professionals are women. And there is some evidence that these professionals prevent African American fathers from receiving assistance and consequently serve as barriers in their involvement with their children. And that, in turn, can lead to a cycle of exclusion. Tell us a bit more about that.
Absolutely. And that is why I say it, right? So when you hear a lot of men talking about the need for fatherhood services and various things, there's a deaf ear that kind of turns
Mm-hmm.
because it seems self serving. So when you hear a woman saying, look, we need to really support these fathers, there's a need for services, then people kind of perk up and kind of listen a little bit.
Mm-hmm.
And so this isn't something that I just created. It is definitely a personal experience just from having worked in social services and seeing, yeah, the majority of the professionals are women. But that's statistics, that's research. They've done
Yeah.
research years ago on child welfare workers, on social workers, and really identified that there are biases that these professionals have and practitioners have against working with fathers. And that a lot of times leads to them not offering the amount of resources and services that they would for a woman coming in, and that's for a number of different reasons, right? And so we have to get to the root cause of those reasons and
Mm-hmm.
really help
Mm-hmm.
them to understand that before we can even start to talk about, okay, these are evidence-based practices and these are things they really have to deal with their bias and the various baggage that they bring to their jobs, and so that's a lot of the work that I do. And why I do what I do is because I know that there are women that need to see other women supportive and as advocates and saying, look, this is something that you can do. This is not just for men to be the only ones providing services to men. There's just not enough of them in these fields to do that. So we have to step up and we have to advocate for what's right.
And I know you talk about the specific changing of attitudes and narratives for the individual therapist or service provider, but you also talk about the larger systems changes. And so, as well as the socio-historic, socio-economic, and multiple other socio elements that influence what we're seeing today. A paper that I wrote sometime, I think in 2016 or somewhere around there, looked at the kind of training that young clinicians will get, or that clinicians were getting, and whether or not there was anything in that training or preparation around engaging fathers. And across the board, we were seeing nothing.
Correct.
And if there was anything, it was so limited that, if anything, it made clinicians even more trepidatious, if that's a word, of venturing into that space, because it was so limited in its scope that it felt like something that should be avoided rather than something that should be embraced. And because of that, of course, we were seeing far fewer fathers, and even more so, far fewer black fathers in some of those spaces. You write that engaging the analytical discourse about fatherhood must begin with a review of and a discussion about the family in the context of American history. It sounds very simple, but it's so profound. It's such a huge nugget to kind of break down. Can you tell us a little bit more about that?
Yes. And I probably spent So many hours in the library with my dissertation. I think that might have been a chapter in and of itself, just going through the
Yes.
history of African Americans once they reached these shores and how that history all the way through now, the way that our families have been impacted by public policies and by various systems, it really needs to be explored in order for us to understand what's happening now with fathers not being included in a lot of services, whether it is maternal and child health,
Hmm.
just in the name and of itself, like how that
Exactly.
even started. Why do we just think that we only need to focus on mom and baby during this time, when there's a father that's there as well. But these things started way back when we first, like I said, hit these shores, and the various services and various policies and laws that were put in place that separated a lot of families. But we do see that resilience. We do see that even when the Reconstruction period was going
Hmm.
on and slavery was over, those fathers were going and looking for their families. Those fathers were going and trying to find their children and their wives and wanting to put things back together. And so we kind of trace over history just how, particularly after slavery, Black families were trying to bring themselves together, and create a society that they were,
Hmm.
kind of locked out of, and creating a lot of things on their own and supporting each other in the community to be stronger. And then we see, just a number of different policies that went in place to try to break that up, to be honest, to try to tear those things down and that strength that we had tried to build up for ourselves. And so it's just this weird cycle, in our history, and we're starting to see a little bit
Hmm.
of it still now with various policies that are coming out now, to break up families. And so, there are still some states that don't value shared parenting. They don't value the co-parenting, even if the parents, are equally involved in the child's life and things like that. So there's a number of different policies that started from way long ago, that we really need to evaluate if we want to really make impactful change and effective change in the way that our families are seen and served.
I like that you kind of drag history out of the darkness and into the searing light of truth. I'm gonna write that down. I like that. Um, so the usual narrative that we get is that of the absent black father, the father who has abdicated his role and blah 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 blah. And we know that the research says that that is an outright bold-faced lie. That that's not the case.
Yeah.
Are there absent fathers? Yes. Are there fathers who've abdicated their roles? Yes. But that is not by far what the story is. And the history that you're pointing out kind of gives us some context to it, that
Yeah.
even coming straight out of slavery and Reconstruction, those individuals who were enslaved, or these men who had been enslaved, their first course of action was to go find their children, to go find their wives.
Yeah.
Not the story that we'd been told, that these people had abdicated their roles and were not interested in their children. It just seems so barbaric. And the continuation of this barbaric portrayal of black men is part of that whole narrative. But I think as you've couched it in that language for us, it helps us, and in that history, it helps us kind of understand it a little bit better. What you've also done in your book is that you've used some tried and true models to help us rethink and restructure how we process the idea of father involvement and African American families. One of those models is Andrew Billingsley's holistic model for African American families, and about how African American fathers specifically must be understood through their interactions within their communities and society. Can you tell us a little bit more about this holistic model that Andrew Billingsley shared with us?
Yes, and a lot of it, and my research is really built on these systems perspectives of how we're not just, these individuals that are just to ourselves and in these silos that a lot of our services and programs are kind of designed around. That's not how people live. That's not how people move and operate in the real world. We're a part of a whole community. We're a part of our families, and our families are extended. They're not just our children or our partners, but they're our cousins, they're our grandparents. We really have to look at that whole picture when we're looking at the African American family, not just that individual folks that are in the household, but the larger community, the neighborhood that they reside in, and also kind of those other connections and social networks that they have that extend beyond their household. And so that strengths perspective and that holistic perspective that I lift up is something that I use to guide all of the work that I do. And even when you were talking earlier about this historical perspective from slavery, we still have to look at the fathers now and think about those root causes, not just, all the way
Hmm.
back then, but the fathers now. What are some of the issues that they're having to where they're not able to be as engaged as they want to be in their child's life, and get to understand that it may not be all the way back to slavery, but it's something that's happening right now, in their lives that needs to be addressed. And so we have to look at the whole person, and understand their context in order to really serve them well.
I love again the way you continue to contextualize this discussion within the concept of the history, what went before. To be able to understand and to move forward, we need to know what contributed to what we're currently dealing with. And so when you think of historically how formal social service institutions tended to systematically exclude African American families, I think of things like the Elizabethan Poor Laws,
Yeah.
and traditionally how African American families have never been viewed as the deserving poor, quote unquote. When you think about the shortage of services to low income families, so not just the shortage of helping professionals, but in general, that larger contextual issue of the shortage of services to low income fathers and families. Tell us a little bit more about how those laws and systems of exclusion have affected and are affecting these families.
Yeah, absolutely. So that whole concept of the deserving poor, those who are worthy of services, that whole definition has been problematic for us for a long time. Who do we consider to be worthy? Who do we think is deserving of services? And a lot of times it's not fathers, because in our society, we look at fathers as they should be the ones who are providing, they should be the ones who are, they don't need help, and they should not get it. If they are asking for help, then that may be something, a farce, something that shouldn't be believed. They need to
Mhm.
just get on up and do something for themselves. And that's more of a societal, cultural kind of assumptions about male gender, and about what fathers or men should be doing in society, as opposed to looking at people again just as they are and what their needs are. And so there has been this societal definition of deserving and worthy, mainly around women and children, primarily children, I think, for the most part, because, if you say it's in the child's best interest, or if you say we're doing this for the child, more than likely you're going to get people on board. But if you start to talk about the adults in the situation, we really don't care too much about about them. But if you start to talk about children, then there's this idea of worthiness. And so a lot of times when I am talking to certain audiences, I have to talk about the outcomes for children when fathers are involved. And that seems to get their attention a little bit more, because it's like, oh yeah, we care about the children. So we want to make sure that we're doing everything for them. So those ideas of, from, like you said, back then, the Elizabethan poor laws, they are still present in people's psyche about who is worthy and who is deserving of services. And that's what we have to really try to shift.
In your book, you shared some stories about new fathers in Louisiana who describe being willing, able, and present in their children's lives, but without informational support, from the hospital or nurses when their child was born, which kind of makes me think of a study that myself and a colleague just completed in Milwaukee with new and expectant black mothers and fathers. And it sounds like whether it's Milwaukee or Louisiana or Atlanta or Minneapolis or Georgia or wherever you happen to be, the story is very similar, which suggests that it's not just an issue of location, unless by location you mean America. It's not just an issue of location, it's an issue of this history and a remnant of this history. So essentially, these fathers were reporting that they felt ignored by hospital staff and they wanted guidance and information on taking care of their baby, but that seemed to be directed to the mothers instead.
Yes, absolutely. And that study in particular was my entree into father engagement in maternal and child health services, really wanting to make sure that fathers had access to prenatal education as well as, throughout postpartum, getting some supports for them. And so yes, it's very true that fathers wherever they are, particularly during this time period, like I said, it's called maternal and child health. So there is really not a thought, whether it is implicit or explicit, that we need to be thinking about what the father is going through or what he needs. And so a lot of the fathers in that Louisiana study talked about not having any supports. If they asked them what community resources or what organizations are reaching out to you or do you look to for support, they couldn't name one. The only people that they saw as supports, they would ask their mothers, they would ask their grandmothers, people close to them, about how to engage with this new baby that they had. And so again, that's just in maternal and child health, but you can find that story across a number of sectors and across a number of locations, like you said, whether it's mental health, whether it's housing, whether it's employment, anything you can look at, fathers are not really thought about as the initial clients that need to be served.
And this fits very well, one, with the story that you told about how these black men who had just been freed from human trafficking, essentially, from slavery,
Yeah.
how their first instincts were usually to go find their wives and their children. And so what we're seeing here with Louisiana and Minneapolis, that even when fathers were experiencing these situations where they were feeling unwelcomed and unappreciated and unengaged or disengaged, well, not disengaged, but more unengaged rather than disengaged in those spaces, most of those fathers were still able to identify a resource within their neighborhood. They would, like you said, connect to a family member, even when they could not find a specific resource within their community. So, what you're describing sounds like that informal support system for black fathers. The current system is not geared towards meeting the needs of black fathers, and it's trying to find that informal support system. And can you talk a little bit about the difficulties that black fathers have in trying to find those informal support networks for themselves?
Yeah, I think that a lot of that goes back to the stigma or goes back to some of the cultural stereotypes around asking for help, and not wanting to be seen as, they don't know what to do because everybody is assuming that they should know. And so it can be hard even within those informal social networks to say, "Hey, mom, I don't know," or "Hey, dad, I don't know what I'm supposed to be doing with this new baby," or "I don't know what to do with my teenager," or "I don't know where I can go to talk about this feeling that I'm having, this sadness that I've been having for, a long time." There's difficulty in asking for help. And we know that, we know the research about that for men in general in terms of their willingness and knowledge of how to ask for help. But it makes it even more difficult when you don't have those resources available when you do ask, or when you do ask, you're treated like, you know, you're dismissed, your requests are dismissed, or there aren't any services available, you're given the runaround, go and talk to this person or call this number or send an email here, and nobody's responding and nothing is really, you're just getting the runaround. So it's really important that, although there are those informal networks there, that we do push our existing systems to make sure that these resources are available for our fathers when they do need help.
So at the top of this episode, I mentioned that you had identified these two areas that needed to be embraced if we were going to move towards father inclusive services, and that's father awareness and father friendliness.
Yeah.
And obviously, those things are not the same since you listed them as two separate. Could you tell us a little bit about them and how to differentiate those two?
Sure. They have really set out this foundation and this hierarchy of what father inclusive practices will look like. And it starts first with father awareness. So just being aware that fathers are important, fathers do contribute positively to their children, to their families, and to their communities. Just being aware of that is the first step in being a father inclusive practice or program. And then you can move to father friendliness, where you're really looking around and looking at the environment. You're looking at the space that you're in and seeing, are there pictures of fathers? Is this a welcoming space for men? Do we have programs and services where fathers can come, and feel welcome in this space? So that's that father friendliness. And there are a number of different assessments that are available, freely available for programs to and organizations to assess their father friendliness on a number of different levels, whether it's their staff, whether it's their leadership, whether it's their organization, whether it's how they're seen in the community. There's a number of different ways they can assess that and make changes in that space. We ultimately want to get to father inclusion, and that is really where fathers are not just seen as afterthought or seen as they can participate in, but they can really be involved in saying, this is what we need, and having father specific resources and services for them, making sure that they're at the table and they're able to make some decisions about programs and services that are available. So that's what we ultimately want to get to, is not where fathers are an afterthought, but they're included, and we're not just doing things that we think they may like or that we think they may need, but these are things that they've told us, and these are things that they are also actively involved in delivering.
So I think as we come towards the conclusion of the episode of the podcast, I think the thing that might, or at least the idea that might be sitting in the back of a lot of people's minds is, I wonder how she came to this work. How did she get to this? And why is this Black woman focused on Black fathers? Why this out of all of the potential topics? Not that this is not a great topic to be focused on, and that you should not be doing it too, but how did you come to this work, and why this focus on Black fathers?
Yeah, and to say it's an accident is just crazy. I feel like this is a calling. I feel like this is something that I've always supposed to do. I don't think it's any accident that I was around a number of friends who were raised by single fathers. I don't think that it's any accident that my father is actively engaged in my life, although he did not live in the home with me. I have a number of men around me who are not perfect dads, but they contribute so positively to my upbringing. And so when I worked in the child support enforcement office, I don't work there now. Let's be clear, I don't work there anymore. But when I worked there, I just saw such a great need for resources and services for fathers. I worked specifically in the office that handled cases where the mother was receiving welfare, or TANF as it's called now. And so the in my mind, the mothers were no better off than the fathers were in those cases. And mothers were being offered, employment opportunities or other programs and different things. And the fathers are basically like, if you can't pay, then XYZ is going to happen to you. All of these various enforcement actions. There wasn't really a program, or a resource or a service to say, okay, you can't pay, what's going on and how can we help to make sure that so I saw that gap. We did have the Georgia Fatherhood Program, and so I started to work there as well. And just continuing to see across a number of different sectors and services that people really just don't think about fathers' needs and the need for these various programs and services. And so it just, I believe, as these various experiences kept happening and kept talking with fathers and working with the fatherhood organizations and seeing such the great need, it just kept fueling the fire. And so I'm just, yeah, I'm just here very passionate and really wanting to make a change in this space, personally and professionally, seeing the professional, the gaps in the research, seeing the gaps in the education space. Like you said, there's no real curriculum
Mhm.
or not a lot of textbooks for students that talk about fathers in a positive way and how they should be engaged. Seeing lack of consideration in the policy space. So there's so much to be done. And so yeah, so I'm just very
Mhm.
passionate about all of that. I have a son, you know. I want to make sure that he's not talking about these same things when he becomes a father. I have a husband, you know, all of these things. So it's personal and professional for me.
So the two things that I heard you say that still just like hanging around like stars in my mind are one, the different types of families that you grew up around and saw. So you had your dad involved in your life. You had other people who you saw who were not the best of fathers but were trying. And then you had single parent families where fathers were non-residential. And then I also hear layered on top of that, this I felt like I was supposed to do this work. So if you
Yeah.
could maybe spend a couple of seconds telling us about how those two things make sense, how those two things come together. Your
Yeah.
personal experience of these various types of fathers and families, and this innate kind of desire and almost like a feeling for a spiritual calling, almost a vocation for
Yeah.
this work. How those two things come together.
Yeah, absolutely. Like I said, I don't think it's by accident that these things were just burning for me, you know, that I pay attention to them, and that I had these various experiences. I don't think that's by accident. And I did try to, you know, go into other areas. You know, once I graduated from University of Georgia with my doctorate and wrote the long dissertation about fatherhood and engaging, I'm like, boom, I
Uh-huh.
did it. Like y'all, everybody go after it. Just do what I said, and it will be good.
Right.
You know, but I kept on hearing like this stuff is not getting any better. These things aren't changing.
Mm,
And so it was like, okay, I'm really passionate about this. I really want to see there be change in this area because we can, and it's the right thing to do. So let me get back, you know, into it and really focus in on how we can make changes, like I said, in those four spaces, in the education space, in the research space, in the policy space, and practice space. And ever since, I mean, it's hard for me to describe because it is just something I'm so passionate about, and I absolutely love all of the fathers that I work with, and it's just such a rewarding experience. And sometimes you do feel alone in it because no one really, it's not something that people, it's not the sexy topic, right? It's not the thing that everybody wants to do. Like talking about fathers, sometimes it's an uphill battle
mm,
to get people to understand why you're passionate or why this should be done. You know, a lot of times I'll start to talk about fathers and they start to say, well, what about domestic violence, you know, or well, what about, you know, just all of these terrible things. And it's
yes.
like, yes, I understand that that happens as well. When I'm talking about these dads that I know who are trying
Hmm.
and are, you know, trying to get access to services, they are in their children's lives every day. I'm not, why do we have to now just put them in a whole other bucket of unworthy, you know, and undeserving?
Right.
And so I think just those continuous interactions with men and the fathers in my life, I think it just continues to fuel, you know, this desire to make a change.
Thank you so much for sharing that. I really appreciate it. Appreciate all of your work in this area and how you're advancing the field in this area, both thinking and the way we eventually will start practicing related to fatherhood. Thank you very much.
No, thank you.
We just spoke with Dr. Latrice Rollins, who shared some really insightful information with us about Black fatherhood and Black families. Probably one of the most important pieces I picked out from that, or at least the piece that sticks with me, is that of the history and the context against which the story of Black fatherhood should be told, but is not being told. And so the image that is seared into my consciousness is that of the free Black father rushing out to try to find out and trying to track down information that would get him reconnected to his children and his family, to his wife. That is not the story that is being told today. That is not the story that we've heard. And yet that is the truth. That is where Black families started. The stories of free Black folk coming together to create community, not just to support each other, but to build themselves as individuals, as families, and as a community. And we're seeing that history perpetuated today. Some of the same struggles from back then remain, and yet fathers are prevailing. Fathers are continuing to work, sometimes in the shadows, not expecting any kind of adulation for their work, but continuing to struggle, to strive, to be present, to support their children, to support their wives, to support their families. And as we prepare to launch this podcast, hopefully this will be launched by the time we get this. As we launched this podcast last year, we had 3 words in mind, and that is educate, validate, and elevate. And today, as we end this episode, I want to elevate Black fatherhood, to recognize the Black fathers who are out there doing the difficult work without any recognition, who are trying to take care of themselves, not just for themselves, but so that they could be present for their daughter walking across the stage for graduation, their son starting his new business or becoming a father, to be able to retire with their spouse or with their children, being able to live long enough for that, even when challenges continue to dog them, for want of a better word. Latrice Rollins does quite a bit of work in advancing conversation around fatherhood, changing the narrative around fatherhood, but also trying to address some of the policy issues that make it difficult for enhancing the kind of work that fathers are doing in their families. And I want to thank her for doing that. Thank her for the work that she's putting out there. I know she mentioned not seeing the needle shifting too much. And yet when I hear about people like her doing this really great work, it tells me that the needle is shifting a little bit, that people are talking about fatherhood a little bit differently. Fatherhood is becoming a little bit more of a common conversation. We want it to become even more common, so that when we talk about families, we don't just talk about maternal and infant health, as she alluded to, but we talk about father, mother, and infant health. Because even when we say parent, by default, we mean mom. And so to be able to very directly mention fathers and to highlight fathers, and in this case, to highlight Black fathers and the roles that they're playing, is a monumental task, but one that definitely needs to be done. So we thank you, fathers, for all the work that you're doing. We encourage you to continue doing it. Find the services in the formal spaces if you can, and if you can't, find them in the informal spaces. Find people around you. You could also use this podcast, these episodes, as a way of encouraging conversations among yourself and your peers and with other individuals. Recommend these conversations to your care providers as a way of saying, I can't tell you everything that you need to be doing, but go listen to this podcast episode from Dr. Latrice Rollins. She will tell you what you need to be thinking about, how you need to be thinking about friendly spaces for fathers, encouraging and inviting spaces for fathers. So share this widely and continue to be good to yourself and be healthy. You've been listening to the Black Fatherhood Podcast. I'm your host, Dr. Alvin Thomas. I'm a clinical psychologist, researcher, and the director of the TriLab at the University of Wisconsin-Madison's School of Human Ecology. Original music for our series was composed and performed by Micaiah De Silva. Our series producer is Joe Ruby. The podcast is supported by the School of Human Ecology at the University of Wisconsin-Madison. And you can follow me on Twitter at Dr_AT758. That's Dr_AT758. And on the web at thomaslab.humanecology.wisc.edu. Make sure to subscribe to the Black Fatherhood Podcast wherever you listen to your podcasts.